So maybe before going to the NICHE trial, one other thing about the NICHE-2 trial is that we presented circulating tumor DNA data, which was also a first. And basically what we wanted to show is, can we use ctDNA to predict pathologic complete responses, because we're not able to using radiology and CT scans. And what we showed there is that 83% of patients had cleared their ctDNA by the time before surgery. And that was in 92% of the patients with a pathologic complete response, while the patients with a major pathologic response only cleared in 70% of cases. So it seems that ctDNA may help us in the future to pursue organ preservation for those patients who want it. And we also showed that at the MRD time point, so minimal residual disease after surgery, none of the patients had ctDNA positive results, which was very much in line with the 100% 3-year disease-free survival data that we showed. So that was just corroborating what we're seeing in terms of survival for this patient population. And then the NICHE-3 was also presented here at this ESMO, and NICHE-3 is a similar trial within the NICHE platform, but the difference is that we use a different type of immunotherapy combination. In NICHE-3 we use the combination of Nivolumab plus Relatlimab. We use 2 combination cycles with 4 weeks in between, and patients underwent their surgery within 8 weeks of treatment. And there we saw very similar results in 59 patients total, and we showed the pathologic response data at this ESMO and the safety data, of course, showing that patients had a pathologic complete response, again in 68% of cases, and a major pathologic response in 92% of cases. So that was very similar to NICHE-2. In terms of safety, we can conclude that the treatment was safe. We did see differences in terms of safety with NICHE-2, with a bit of a higher rate of endocrinopathies and grade 1 and 2 adverse events in terms of hypothyroidism and adrenal insufficiency, but in general this treatment seems to be safe and highly effective. So these were 2 very similar studies, but with completely different types of immunotherapy, showing that patients with MMR-deficient colon cancers respond very well to immunotherapy, with just very short treatment duration prior to surgery. And we actually published the NICHE-3 study concomitantly at this ESMO in Nature Medicine. So it's open access and free for all to read.